We found out that we were pregnant September 27th of 2019. She took the pregnancy test. I could hear her feet stomping through the living room, running to the room, in excitement. But little did we know that her health was declining at such a rapid rate so fast. And they tell us at this time, well, the only option right now is a C-section. I just remember her panicking and breathing very heavy, frantically, and she just kept repeating to herself, yes, all three of us are going home. All three of us are going home. I was hearing them say that they needed all medical emergency personnel to her room. So my heart dropped. That's when I knew that I lost Amber. I remember waking up and rolling over to tell Amber that I had a really bad dream. And
I'm so sorry.
She wasn't there. I founded the Save a Rose Foundation, of course, after losing my partner due to medical negligence that was 100% preventable. I started creating so much in her honor.
Hi, everyone, and welcome to the Born Into podcast. I'm Isra, Chaker, CEO of Every Pregnancy, and I'm so glad you're here. This podcast is about something that impacts every one of us, but isn't talked about nearly enough: the health of moms. Each week, we bring you stories of courage, crisis, hope, and facts from around the world about what it is like to be a mom, help a mom, or support a mom. Today, I'm honored to speak with Bruce McIntyre III, whose advocacy for mothers began with a personal tragedy. I'm hosting from our Every Pregnancy offices in the DMV, and Bruce is joining us virtually from Bronx, New York. Bruce is a father, artist, educator, community organizer, activist, and the founder of the Save a Rose Foundation, a nonprofit working to address systemic flaws in the U.S. maternal healthcare system and advance birthing equity, particularly for Black families and people of color. He is also working to build Bronx's first midwife-led birthing center. He educates medical students about racial bias and has testified to White House officials. His advocacy began in April 2020 when his partner, Amber Rose Isaac, died during childbirth due to complications from an unscheduled emergency C-section. Bruce and others have identified her death as a resulting from medical negligence and systemic bias. Her story is not unique. Black women in the United States are 3 to 4 times more likely to die from pregnancy-related causes than white women, and other women of color also face disproportionately high risks. The Bronx, where Bruce lives, has also some of the highest rates of severe maternal morbidity in the country, highlighting how systemic inequities play out locally. In this episode, Bruce will share how he turned his grief into advocacy, working to ensure mothers have access to safe, respectful care. We'll discuss what it really takes to achieve birth equity for every mother and the role of community-based support in creating meaningful change. Bruce, welcome to Born Into.
Thank you for having me.
So Bruce, for those who are tuning in and have never heard about you and your incredible work before, how would you like to introduce yourself to the audience?
You did amazing, honestly. Bruce McIntyre III. I founded the Save a Rose Foundation, of course, after losing my partner due to medical negligence that was 100% preventable. I started creating so much in her honor. So thank you.
Thanks, Bruce. We're so excited to have you here. And it's important to talk about this topic in general. We've had multiple guests on season 1 talk about, maternal mortality to Black women in particular and how racism and bias drives that. And obviously you have a very personal connection to this story and to this entire issue, and the systemic issue has affected and plagued your own family. What can you share with us about your incredible partner, Amber, and that horrifying experience that you had to endure?
Amber was truly a light. She was someone that was very special to me. Someone who was constantly feeding me positive affirmations, someone who's dealt with serious depression and anxiety, and she was really one of the only people in the world that I was able to confide in, and she always gave amazing, incredible advice, and she always showed up. She always found a way to show up, and that's just the type of person she was. Such a very loving, caring person. She genuinely wanted the people around her to do well, and and she was just always uplifting spirits. So I learned a lot from her. And it's really sad to see, this happen to such an incredible woman. It's really sad to see this happening to anyone, honestly. But it was something that we never thought would even be a possibility or a reality for us. Losing her was really tough, and it was very life changing, especially for someone like me. But I'm very grateful for experiencing her, and I utilize the tools that she's given me every single day. Those times where I'm feeling hard on myself, or those moments where I feel like I need to like release. I know that it's okay because of her. I can be vulnerable. I can allow my walls to come down, and I can express myself, and I can communicate how I'm feeling. And she really taught me all of that. And I believe, there's people who ask me all the time, like, how do you have the strength to do what you're doing? Like, how are you able to go up and, speak to hundreds of people? And, and I tell them all the time, like, that's the strength and power and the testimony of Amber. Because if I didn't meet her, and if I, didn't get to experience her in the way that I did, I don't think I would be as strong of a man I am today.
That's such a powerful reflection. I'm like overwhelmed thinking about how sweet and kind that was, but also how real that felt. Yeah. And I love that you led with who she was and her personality and her character, because oftentimes when we think about moms, especially moms who die in childbirth and in pregnancy, they're just statistics to so many people, just another woman, just another person. And we don't recognize that these people are real human beings full of so much personality, so much color, so much love and joy. And the impact that she had on you in particular is so powerful. Bruce, for those listening, like, they're going to say, well, how did she end up passing away? What failed her? So when you talk about negligence, what are we talking about in the case of Amber's untimely and tragic death?
It was definitely gross negligence that we experienced. So she's known her gynecologist for quite some time, and, she thought that she was somebody that she could turn to and trust. But whenever she became a Black, unmarried, pregnant woman, it seemed like that care started to shift.
Wow.
I remember going to the very first prenatal appointment, because I showed up to every single appointment. I drove her to every single appointment. I was, sitting in the rooms with her every single appointment. Because we like to say that, this is our pregnancy, this is our child, and this is something that we both need to be attentive for. So I was taking her to her, her appointments every single time. But I do remember the very first time meeting her OBGYN was just very unsettling for me. Wow. Because instead of feeling like I was in a safe space, I felt like I was being judged immediately, just based off of, little factors. Like, I remember, she knew who Amber was, of course, but she didn't know who I was. So she was asking me, a series of questions. She's like, are you and Amber married? And, we tell her, no, we're not married. However, we do have plans.
Yeah.
And I just remember her smacking her lips and twisting her face and rolling her eyes. And I was feeling, uneasy and judged right off the bat. And then she asked me, do you have any other children? And I tell her, yeah, I do have, other children. Back, where I used to live, and again, with the smacking the lips and the twisting the face, and so I felt like, I was really being judged. But and then I also noticed, I felt like I wasn't being seen in the room as a father. She was, only having the conversation with Amber, only having, eye contact with Amber. She's not trying to have a conversation with me. She's not, handing me papers or anything to hold on to and go over with Amber when we get back home, none of that. So, but I'm very grateful that Amber was someone who always took initiative to understand something, because when she felt like she didn't understand, she would, she's someone who wants you to walk her through it so she has a full understanding of what's going on in her body and the things that she needs to do. It's her first pregnancy, and she wanted to make sure that she was making all of the right and healthy decisions. She was very cautious like that. And I just remember that, the OBGYN wasn't really being attentive after that appointment, after that first appointment. She wasn't really walking Amber through, the process, which Amber ended up taking the initiative to just, buying a book and reading her prenatal book and, taking her prenatal vitamins. So she took it upon herself to educate herself and to, study the changes that were going on in her body. Because she felt like she wasn't really getting that from the OBGYN. And we found out that we were pregnant September 27th of 2019. Okay. Is, when we found out together. She took the pregnancy test. I could hear her feet stomping through the living room, wow, running to the room, in excitement. Yeah, she was very excited. She was very excited to be a mom. But little did we know that her health was declining at such a rapid rate so fast. We had no clue. That December 2019, Amber's platelets were deteriorating at a rapid pace, and we weren't being made aware by the gynecologist what was going on. So months go by. We're trying to figure out a birthing plan. Because we felt like we were, facing so much neglect from the gynecologist that we decided to look into other options. Months go by, we're not hearing anything. We still didn't even know about her platelet levels at this time.
She had no idea she was dealing with this condition.
We didn't find this out until April of 2020. But after looking back at the records is when we found out,
Bruce, if I can ask you a quick question, this is all like a blood work, right? Like a typical standard blood work. So
exactly.
Typically, when you're going in for your antenatal appointments, a woman, no matter who she's getting pregnant here in the U.S. at least, goes to these appointments or should, and then gets her blood work taken regularly. Mm-hmm. And so they had this information knowing that her health was deteriorating and that there was an issue and no one was flagging it.
And there were multiple people signing off on the paperwork.
Wow.
There are multiple people who go through it and read over it, and they're signing off like everything is okay.
My gosh.
And we decided that, we're facing so much neglect and, this has just been such a horrific experience for us, that we were going to look into other options. And that's when we looked into midwives. I actually took the initiative to find our midwife and interview the midwife, and she was a perfect match for Amber. Amber loved her. And at this time, she was actually a student midwife. And we got her about March. We got some blood work done. And yet again, just that delay of information, which is, a perpetuated cycle that we see very often in this, in the system. Yeah. Just that delay of information that could is valuable in saving a life.
Yeah.
So our midwife was asking for, blood work. She needed to get the updated blood work to see where we were at, and, what steps we needed to further take. And, Amber's reaching out to this office because, she just got her blood work done that February of 2020. We're coming into March where, still haven't got any updates through her My Chart, nothing. We finally got the blood work back towards the end of April, or back towards the end of March coming into April. And that's when the midwife took one look after sending the information for the first day. She called us back the very next day and told us that Amber is extremely high risk and that we could not have her as a midwife. Due to her being so high risk, she needed to be in a hospital. We weren't able to go to a birthing center. We weren't able to home birth. We had no options. We had to go back to the hospital. And at this time, with this information that we're finding out, Amber is trying to switch her over to a new OBGYN. And at this time with the pandemic arriving, and all of this neglect was taking place before the pandemic even arose. She was being grossly neglected before the pandemic even started. But once the pandemic started, it felt like a further excuse to try to push her away. So Amber was trying to get early FMLA and early disability for her, for job security. At the time, she was
Yeah,
an
of
early life
course.
educator,
Of course.
teaching 3K students. And at the time, there were kids who were coming to school sick and with no doctor's notes, and it was just a dangerous environment for her. She was having troubles breathing, feeling that sense of dizziness all the time, having to carry children up and down stairs. Children are coming to school with no doctor's note and they're coughing, and it was just a dangerous environment for her. And we were trying to, because we were due of May 2020, she wanted early leave for April instead of May, due to the conditioning in her body and how she was feeling. So, she's speaking to the same OBGYN, sharing all of her concerns, and they were just being taken lightly. The OBGYN told her, you are not the only pregnant woman going through this right now. Why should you be the only exception? Why should you be the exception to have early FMLA, early disability? So instead of writing on the FMLA forms that, the conditioning that was going on with Amber, she wrote on the FMLA forms that Amber wanted to leave for personal reasonings. So Amber's job denied the FMLA request, so which we had to go through, this process again. This time getting her mother involved in filing complaints. Her mother also worked in the same healthcare system that she passed away in. So started off at Montefiore Moses, and we were transferring over to Montefiore Einstein, where her mother physically worked for 25 years out of Amber's 26 years of life. Higher ups are, promising us all these things. And so we redid the FMLA forms, did it over again, submitted the request, filed the complaints against the OBGYN, and then we ended up switching over. But the OBGYN told us the only way that she'll be able to get early FMLA, early disability, is if she sees a high-risk doctor. We weren't appointed a high-risk doctor by the OBGYN. She was just telling us that recommendation.
So she didn't refer you to somebody.
So she didn't refer us to anybody.
Wow.
So we ended up, transferring over to a different hospital, because here we are in April. We're supposed to be giving birth here in May. So once the midwife made the discovery and we filed the complaints, we sent it over to the other hospital. The other hospital says that they needed updated blood work done, so they made this appointment for us to go into. I was driving Amber to her appointment, and this was I believe April 17th of 2020. We were getting updated blood work done after finally, trying to get everything in the clear. And we head to our appointment, and Amber is turned away. The people at the blood lab are telling her, well, the OBGYN never submitted all of the paperwork. They're trying to get a hold of the OBGYN. She never submitted everything that they needed. So they were constantly trying to get a hold of her that day to, submit the paperwork that she needed. After we were already told that everything was taken care of, all we had to do was show up. So they asked us, hey, can you guys, leave and come back later? I ended up taking off of work. We left again. We came back. And I just remember on our way back to the blood lab for the last time, I just hear Amber's nails just cracking against the screen, tapping really hard. Because she's very upset and she's very angry.
It's so frustrating.
And unfortunately, that was her last and final tweet, which since then Kamala Harris also reposted, stating that she wanted to write a tell-all about the negligence and the incompetence that she had been dealing with throughout her entire pregnancy.
Oh my gosh.
So we go that day, we get the blood work done, come back home, and the next morning on April 18th, they call us in and say that Amber needs to come in for treatment. So we head in, myself, her, and her mother. We get to the hospital, and we're telling, the receptionist and, the people at the front exactly what's going on, what we're here for. They called us in for treatment. And Amber was terrified. She didn't want to be by herself.
Oh my God.
Very understandable.
Yeah.
So she's, begging and pleading for me to find a way to come up with her. Because at that time they weren't allowing, spouses to be with you, family members. They weren't allowing midwives. They weren't allowing doulas to be by, their client's side, and to, advocate for these families. So I was telling, the receptionist, like, this is no fault of our own. This is a mistake by the hospital. She doesn't need to be by herself. Either myself needs to be with her or her mother. And they're denying me to go up with her. They denied that as well.
Oh my God.
They told her that her mother couldn't go up with her either, that she had to be by herself. So that's very upsetting, but I'm not trying to cause a scene. And
It just puts you in an impossible situation.
exactly. And so a security woman comes up to me and she says to me, "Okay, Mr. Baby Daddy, you need to go have a seat. Matter of fact, we don't want you sitting in the lobby. You need to go outside and wait in your car and wait for her to text you updates." Which was just very,
Bruce? Are you serious?
Was just very disheartening to me.
What?
It was very disheartening and was very disappointing. But of course, me not trying to cause a scene, I walk outside. I keep,
That sounds cruel. Not even just disheartening. That's cruel.
It was very, yeah. And her mother is texting me updates while I'm sitting and waiting in the car. And mind you, I didn't raise my voice. I didn't anything. I was just advocating for my partner. But Amber was someone who always took very good care of her health. So we were just very confused to how and why this was happening. Amber was one of the most healthiest people I ever knew. Held a strict vegan diet during her pregnancy.
Wow.
Was a pescatarian before she got pregnant. Was on top of her vitamins, everything, exercise. She was, really on top of her health. She really, put her health first.
And now she's going upstairs and you have no idea what's going to happen.
Exactly. And so, she's texting me. She's, they still don't know what's going on with her after 8 months of doing blood work. They don't know what's going on. They tell her, well, you may have preeclampsia or you may have COVID. They didn't know what was going on and why her platelets were so low. So still advocating for her behalf and advocating for myself as a father. They finally agreed to allow me to come up with her the very next day because what was supposed to just her being there for treatment for a couple of hours ended up turning to she needs to be here for an entire weekend. And she's never had to stay overnight in a hospital, so she was very scared. But they did allow me to be with her the very next day. Still not, understanding what was going on. They finally told us that she has HELLP syndrome. HELLP syndrome, which is a heightened elevation of the blood and liver enzymes. Her blood was no longer clotting. Her blood was water-like. Her blood was water-like. And by the time she made it into the hospital, mind you, the platelets need to be at a 150, 125, the lowest. By the time we made it into the hospital, her platelet levels were in the 40s. They were extremely low. And they induced the labor, so we were, expecting 40 days premature. And she wasn't dilating quick enough for her. It seemed like that she wasn't dilating quick enough for them. My son wasn't in any type of harm, but they were trying to just dilate her quicker. And I just remember them going over all these different procedures and cesarean section being the very, very last option. So they leave. I have a moment to finally, sit with her and speak with her, because, now we're expecting a delivery of our child. And, just like she would do for me, I was always trying to feed her positive affirmations and was trying to be beside her and hold her hand, but the nurses would come and separate me and tell me, I can't hold her hand because we don't know who has COVID, even though I was tested and passed, and she tested and she passed. The nurse was telling us, there are no nurses right now that are testing. So they don't know if the nurses have it. which was, just also very disheartening for us to hear, considering the fact that we took all the proper precautions to stay safe. And, so they wouldn't allow me to touch her. I had to be on the other side of the room with her and talk to her. So they come back maybe 30 minutes later with the sense of urgency to push Amber into the arms of irrational decision making. And they tell us at this time, well, the only option right now is a C-section. So we need to, perform an emergency C-section. Amber and I both being very nervous about it because it's not what we were expecting. It's not what we wanted. We agree because it was the only option that we had at this point. And they, give us a moment. They come back and they grab Amber and they wheel her off into the OR. They tell me, oh, she'll be in this designated room in like 25 minutes tops. You'll see her and your son very shortly. And I'm speaking to Amber and I'm telling her, this is it. This is our last push and we get to go home. With our child, we got this. And I just remember her panicking and breathing very heavy, frantically. And she just kept repeating to herself, yes, all three of us are going home. All three of us are going home. And she just kept repeating that to herself as she was being wheeled off to the OR. So they appointed me in a designated room. I'm not hearing anything from anybody. Nobody's telling me anything. But instead of sitting in the room, I glued myself next to these double doors that was close to the OR so I could, see her room. And I just remember them rushing a bloody baby out, which I assumed was my child. They were rushing a bloody baby out the room. And over the intercom, I was hearing them say that they needed all medical emergency personnel to her room. So my heart dropped. And, I'm watching doctors run to the other side of the hospital to grab, pints of blood so they can try to perform blood transfusions as she's bleeding out already, which, ultimately was a sign that they weren't prepared for her at all. And the head surgeon never showed up for her and passed her down to a much younger team of doctors. So everything was just really disheartening. But they were trying to distract me from, the double doors and me seeing everything. And they're like, do you want to come see your son? You want to come meet your son? And at the time, I'm telling them, no, I don't right now. I can't handle it right now. I need to know that my partner is okay. So, I eventually agreed to go, see my son. And I'm looking at him and I noticed that during the C-section, they also nicked my son in his shoulder. They cut into my son's shoulder. And at that time, he's a preemie. So it was maybe like 2 inches from his neck. And it was a pretty deep cut. And I'm thinking to myself, wow, something also could have happened to my son. Like, what is going on? I head back up to the room. Nobody's telling me nothing. Hours go by. And I've had enough, death in my lifetime to understand certain signs. So I get back up to the double doors and one of the nurses, she comes and asks me, hey, do you have any family members that can show up for you? And I'm telling them, well, her mother is here in the hospital. Her mother is working on a night that she shouldn't be working, but she wanted to be close to her daughter. So she's working tonight and she's right downstairs. They said, well, do you have anybody for you? And that's when they make me start calling family members. And they were giving me an issue by myself as the father being in the hospital with her. So to understand that they were opening up a family room and inviting me to have family come out was not a good sign. Family finally shows up. They set them up with a designated room. I'm still waiting to hear back from Amber and nobody's telling me anything, but there's one black nurse who just kept, empathizing with me. And I started to just ask different questions like, hey, I know that her platelets were very low and her blood was water-like and she just had a C-section. What's going on? Did they sew her back up after that? She clears her throat and I can just see it and I can see pain in her eyes. And she tells me, no, they didn't sew her back up. And I'm like, well, why not? What's going on? She says that they had to cut her open again, with, her blood not clotting and her blood being water. Like, they had to cut her open for a second time. I'm asking for what? They didn't know where the bleeding was coming from, so they performed an emergency hysterectomy on Amber, and they removed her uterus. And I'm thinking to myself, Amber is going to be so upset when she wakes up, because we just discussed having another child after my son Elias.
Oh my God.
This was our plans. And then I'm like, well, did they sew her up after that? Like, what's going on? She tells me no. They had to cut open her chest and manually massage her heart for close to 3 hours, 4 hours. And that's all they were doing for her. So they cut her open 3 times while her blood and her platelets were very low. I see, a team of doctors coming out of her room. A bunch of white doctors come out first, and, they're patting me on my back like, oh, you're going to be okay. Everything is going to be fine. You're going to be all right. You're going to be good. So that gave me a little bit of hope that she was okay. Because why would you say that to somebody who's going to be dealing with such a loss like that? And, they get to clock out and they get to go have dinner with their families, and, they're telling me I'm going to be all right. Everything's good. Then a team of black doctors come out of her room, and I just see the disgust. I can see the pain in their eyes, and none of them could say anything to me. They were just walking by me with their heads down. And the nurse comes back to me and she asks, hey, can you go to the family room so we can, talk to you? And that's when my heart dropped, because that's when I knew that I lost Amber. And, I head to the room. The head surgeon that never showed up for her finally shows up. He peeks his head into the family room, sees a room full of black folk, and he turns around and grabs a colleague to help come break the news to us that Amber didn't make it. And then they wheeled her body in, and I had to sit with her body for hours, just trying to figure out what went wrong. And it really just felt like a really bad dream, Like, I couldn't believe that was really reality. I didn't want to. Until leaving the hospital. I left the hospital at maybe 5 a.m, drove home, climbed into, our bed, crying my eyes out, and fell asleep. And I remember waking up and rolling over to tell Amber that I had a really bad dream. And
I'm so sorry.
She wasn't there.
I'm so sorry. I mean,
thank you.
I can't imagine. I can't imagine what the experience was for you, for Amber, and how horrifying everything has been for your entire family, and even your son, who now doesn't have a mom because of this neglect, this negligence. There's so many parts of what you shared that I think will hit deeply to anyone listening to this. But more than anything, it's about when you know that you're already walking into a healthcare system that is meant to harm you in a lot of ways, or set up in a way that will be harmed, with no one correcting, advocating. How terrifying that feeling must be. And I feel like for those who don't identify or relate to your identities, or to Amber as a black woman in particular, they can never understand that feeling, and what a privilege it was. But when you think about what you saw and how you advocated for her, how are you now able to navigate maternal health advocacy? Truly, that transformation of that experience to move you into this mission, and now advocate for it as a man, as a father, as a black man in particular, especially with some of the comments that you were dealing with through her pregnancy, the stereotypes that were pushed on you. I mean, it just feels so unfair that you've had to be forced to do this. Yeah. I'm sure a million things were not done right. So many opportunities to support her, so many opportunities to save her life, and just none taken. Yes. And we know that's very common for Black women, but it's not just a tragedy. This is injustice. This is actual corruption. This is actual, in my opinion, like so many things. And there were choices made that were neglectful, but also cruel and also intentional, and also just leaning into the racism that is so biased and so intrinsically ingrained in our communities, and especially in our health system. So how do you navigate the work that you're doing now with all these different identities, but also the experience that you lived through, Bruce? Because that is, wow. I mean, it's so heavy.
Yeah, it truly is. And so that always seems to be like the golden question.
How?
Like,
Yeah.
how are you able to do this? And it's truly just Amber. It's truly because of who Amber was and how powerful she was, and just what she meant to me. Like I said, if I wouldn't have met Amber in the time that I did, I don't know if I would have been able to do this work, been able to advocate in this way. But after she passed away, I could still just hear her voice in my ear, like, telling me what to do, and really guiding me, and then utilizing the tools that she taught me when I would, like, have serious depression and things like that. But I was also very fueled by anger.
Rightfully so. Rightfully so.
Anger truly fueled me. Yeah, because I knew that Amber needed justice for, how she was treated. And I know that if, things were the other way around, I know that Amber would fight just as hard for me. And that's something that I know, and that,
Of course. And of
brings
course,
me
the
a lot of
biggest
peace.
justice would be to have Amber be back with you. And we know that that's not possible. But do you feel like you've gotten
Yeah.
justice for this neglect? Like, what has happened from, not yet. You're working on it. I'm
Not
sure you
yet.
probably can't share things
Not yet.
about that.
Still working on it. I mean, there
Yeah.
are definitely things that I can share, because, what really drove me was how much help there wasn't for somebody like me in my situation. Amber's mother had more resources, to her as the mother of Amber than I had as
Wow.
the father to my child. So, that same week Amber passed away, I wasn't able to take my own son out of the hospital.
My gosh.
They told me, because they knew I was the father of our child, and that was the only reason why they allowed me to be up in the hospital with her. But, and Amber also advocating that I'm the father. Once she passed away, the hospital told me, well, Amber's no longer alive to attest that you're the father, so we need you to take a paternal test. We need you to take a DNA test.
Are you serious, Bruce?
Um,
I can't believe
yeah.
that.
So they asked us to take a DNA. They asked me to take a DNA test. I had to go through this whole process that I shouldn't have gone through. So surrogate's court took maybe 2.5 years to finally give me my son's birth certificate with my name on it, or to have it court ordered to be changed. But I didn't receive his actual physical birth certificate with my name on it until he was 4 years old.
I can't even imagine that as a parent myself. If someone was denying me that right, like that I'm his parent,
Yeah.
I can't imagine that.
hmm So he had to be released to Amber's mother, who they say was the next of kin, even though I was the next of kin. But luckily at that time, Amber's mother was living with me, to help me take care of Elias, and, allow me to do the work that I was trying to do for Amber. And then also, what also drove me was I was trying to give Amber a proper, funeral, because of course we went in there planning for a baby. Now we're having to plan for a funeral. The funeral homes weren't accepting bodies at the time. So I had to raise money to build her a whole new plot of land. And, that's what we ended up doing. We ended up raising money through the community to, give her a proper burial, which is also something, again, that I shouldn't have to deal with as a grieving father who just lost his partner. These are one of the last things that I should have to worry about, but we got it taken care of. And the reason why I was so urgent about it is because the hospital wanted to send Amber's body to Hart Island, where they were dumping COVID bodies in unmarked graves. So they wanted to dump Amber in an unmarked grave, and I just couldn't allow that to happen.
The story could not get any more unjust. Like, truly.
Exactly. And these are just the things that drove me into the work that I ended up doing.
The Save a Rose Foundation, which I love that the A is capital for Amber. What impact has the foundation had so far? Any success stories that you're particularly proud of?
Yeah, definitely. We've influenced a lot of legislation around the nation. I've also been able to educate medical students on implicit bias on, accredited courses throughout the nation as well. Of course, we have the film Aftershock, which also follows the film, which won numerous awards, and I was able to, meet and make so many great connections from that. And also collaborating with my partners in the community, we opened up a women's health clinic in the Bronx, in the Norwood section of the Bronx 2 years ago. And then we just got an investment from Governor Hochul, $5 million investment for our freestanding midwifery birthing center, which we're hoping to have ready by 2027.
Bruce. I mean, way to take really challenging, life-defining injustice moment and turn it into something that's going to help so many other moms and babies, especially in your community. You're building the Bronx's first midwifery-led birthing center. Why was it so important for you to build this type of clinic and infrastructure?
Just doing the studying. Once I got thrown into this situation, I needed to study in order to combat what I was facing, and just come up with innovative ways and ideas to better serve the community and come up with safer birthing outcomes for people, because that's truly what we deserve. It was really the midwife that I was trying to have for Amber. She educated me so much. She showed up for me during my time of grief. She introduced me to grief counseling and all types of resources, and I never had to pay anything out of pocket. Amber was someone who held a strict diet, so I wanted my son to receive the same nutrients and vitamins he was receiving from his mother. Ended up, introducing us to different milk donors and things like that. So I just realized how much midwives and doulas really wanted to help the community, and then also understanding that at that time that there were only 2 birthing centers open in the state. One was in Manhattan, and the other one was in Buffalo, New York, which is hours away. Women are driving 4 or 5 hours just to go to the birthing center out there. And, after doing the statistics and realizing that, the Bronx has the highest maternal mortality rates and, in the city and the state, I realized that, I needed to do something about this, and I needed to work to bring a freestanding midwifery birthing center to the Bronx.
When it opens up, I can't wait to be there at the opening ceremony. Please let me know. Bruce, what do you want other fathers, partners, or support people to know about their role in birth equity? Like, especially like for your own experience, what do you want them to know about how to experience and navigate this entire situation?
Yeah, so what I've been telling fathers is, like, it's really important just for us to show up. Like I mentioned before, like, this is not just about the woman being pregnant. It becomes, about the family and the family structure and us becoming pregnant and, us wanting to, just create a stronger foundation, and just taking the time to understand your partner, to learn your partner, what they're going through. How can you make things easier on your partner to, create less stress in the environment? So that's like, their word isn't law. It's always great to have a second, third opinion from someone highly educated and someone unbiased as well. So I think just showing up is very important, and listening, because in a time where women don't feel like they're being heard in the hospitals, it's very important to make sure that they feel safe and heard with.
Really well said. Really, really well said.
He was
If you
as
could
a
change
supporting
three
partner.
things about the U.S. healthcare system and how it treats Black mothers tomorrow, what would they be?
Definitely more implicit bias trainings and more accountability. I think because, so first and foremost, I think truth and reconciliation is very important. It's the only way that we're going to have any real accountability. Um, and I think because the doctors are so used to getting away with things because they have malpractice insurance that pretty much covers anything, that practically gives you a license to kill. I think, yeah, just having truth and reconciliation really brings closure to families like mine. And then also to make sure that the state is also backed by wrongful death laws as well. So here in New York, I'm also one of the founders of the Grieving Families Act, where we don't have a wrongful death suit in place or law in place, and we're the only two states that don't have wrongful death in their states are Alabama and New York. Everywhere else has, wrongful death. So I think it's important to understand your wrongful death laws. So you can, sue hospitals for grief and anguish because, here in New York State, grief is not recognized at all. So I think that's also just very important. And also with, Medicaid, I feel like it's very important that we're treating people with dignity and respect. And we're not just rushing them out just because, the insurance is lapsing or the insurance ran out. Like, I really wish we could get rid of all that and just create a universal structure. So, families are being seen and, they don't have to worry about their insurance running up because that's often, another situation that we see where, the women are being rushed out of these hospitals. And then they're having situations like pulmonary embolisms. Their next checkup isn't until
or even like 6 weeks later.
3 weeks later, things like that I feel like really needs to be adjusted.
Think about a world where every pregnancy is safe. And the way that we create that world is by ensuring that no mom, no woman ever struggles with getting access to the healthcare that she needs, with getting seen by the proper healthcare officials and caretakers that she needs. No woman should be dying in pregnancy or childbirth. And the experience that you had that was full of so many wrong and hurtful and harmful choices, but then also the way that you were treated throughout the whole entire experience, and just the lack of empathy, the lack of care, and how holding your heart and holding your family's heart, I mean, it's devastating. And so with that, Bruce, I thank you for sharing all of that with our listeners. And so for the last question I have for you, for someone here who is listening and wants to support the work that you're doing, but also wants to do more and says, you know what, this really opened up my eyes. I want to be a better advocate for moms and babies, especially Black moms here in the U.S. What would you tell them to do?
They can always reach out to us at saverosefoundation.org. We're always constantly looking for people, to help us, to spread the word, to spread the net. But my biggest takeaway would be to just study what's going on, because a lot of people don't see this in their faces and don't recognize that this is really going on. So I suggest, doing, some studying. So yeah, we're constantly looking for volunteers. And then we also have a program called the Amber Rose Isaac Access to Home Birth Scholarship Program. And what that does is it offsets the cost of insurance premiums, and it covers what insurance is unable to. And Nubia Martin, incredible. The woman who was going to be our midwife, she leads that. And for these past 5 years, thank you. So over the past 5 years, she's been able to help over 86 families have free home birth. So I think that's just something that's, truly needed and truly incredible.
I love that. We're all about innovation at every pregnancy, and also really highlighting that there are low-cost solutions that can prevent so many of these complications if they're just administered correctly, and getting to the moms and babies who really need them the most. Bruce, if I can ask you a couple of sentences and have you finish the sentence.
Exactly.
As a prompt. You ready? Okay. Every mother should
be loved.
Every child deserves.
every child deserves their mother and their family.
That's really beautiful. The world needs to do more in supporting moms by
Advocating and showing up.
I love that. Those are all beautiful things, Bruce. Thank you so much for being here and speaking with me on the Born Into podcast. Are there any last messages or words that you would want to share with our audience?
Like, I feel like I'm constantly learning every day in this work. And I'm just truly blessed to be in a situation that I am, to be able to give back and help families and direct them from, such fate as my own. It's just very proud moments that I never seen myself stepping into this light and becoming an advocate for maternal health. Like, this is something that I was truly just thrown into. Like, I know a lot of people are like, "Oh, you do so well. How are you?" Like, I never did this work until Amber passed away. So it was truly the love and dedication that I had for her that pushed me through. And for the past year, I've been the only sitting male on the maternal health steering committee for city council as well. So it's opened so many doors, and I've learned so many incredible things to be in this position. So I'm blessed.
Good for you. But you took that opportunity and you took that door and you made such a beautiful path with it. And the work that you're doing is impacting tens of thousands of people. And so thank you for sharing your story and for the work that you do and all the advocacy opportunities that you take, because it is hard and it is draining, especially when you have such tragedy attached to this work at the core of it all. Your work, Bruce, reminds all of us that change often starts with us and using our own personal experiences to motivate our passion and our voice for advocacy and change. The injustice that Amber experienced in her untimely and tragic death should not be the norm in America. It should not be the norm across the world. We need to shatter the status quo and we need to change it. And it takes all of us doing something about it. So whether you can relate to that experience or not, whether you can believe and understand all the details or not, it doesn't actually matter, because what matters is that there should be no mom, no woman dying from preventable complications in pregnancy and childbirth. We will never forget Amber's name, and I want everyone to say her name and remind ourselves of her story, and thinking about that poor baby that left that hospital without his mother, and thinking about Bruce and the impact that it's had on his family. But Bruce is a champion for all of us. So if you're listening to this podcast episode, thank you for listening. Be sure to subscribe to the work that Bruce does. Follow Save a Rose Foundation. Support Every Pregnancy. Follow us on social media at Every Pregnancy or on our website at everypregnancy.org. Sign up for updates and join us in making every pregnancy safe. Thank you, Bruce, so much.
Thank you, sister.